Acute diarrhea is a sudden condition in which a person passes 3 or more loose or watery stools per day for less than 14 days. It is a very common health problem and a major cause of dehydration, especially in children, elderly people, and those with weak immunity. The most common cause of acute diarrhea is infection. Bacteria such as Escherichia coli, Vibrio, cholerae, Salmonella, and Shigella, viruses like rotavirus and norovirus, and parasites such as Giardia and Entamoeba can infect the intestine. Other causes include contaminated food or water, poor hygiene, food poisoning, sudden dietary changes, lactose intolerance, and certain medicines like antibiotics and laxatives. The disease starts when germs enter the body through unsafe food or water. These organisms reach the intestine and attach to the intestinal lining. Some produce toxins that cause excessive secretion of salts into the intestine. Water follows these salts, resulting in watery stools. In some cases, the intestinal lining is damaged, reducing the absorption of water and nutrients. Inflammatory infections can cause leakage of fluid, mucus, or blood into the stool. Increased intestinal movement further reduces absorption, leading to continuous fluid loss. Because of this fluid loss, the body develops dehydration and electrolyte imbalance. If untreated, severe cases may progress to low blood pressure and shock. Common symptoms include frequent loose stools, abdominal pain, cramps, nausea, vomiting, and sometimes fever. Signs of dehydration include thirst, dry mouth, sunken eyes, reduced urine output, and weakness. Severe cases may present with lethargy, muscle cramps, confusion, and signs of shock. Treatment mainly focuses on replacing lost fluids. Mild cases can be managed with oral rehydration. Solution: while continuing normal diet and breastfeeding in infants. Zinc supplementation is helpful in children. Moderate dehydration requires increased oral fluids and close monitoring. Antibiotics are used only when a bacterial infection is suspected. Severe dehydration is a medical emergency and requires intravenous fluids, correction of electrolytes, and hospital care. Acute diarrhea can be prevented by using safe drinking water, washing hands properly, maintaining food hygiene, and ensuring proper sanitation. Breastfeeding protects infants, and vaccination, especially against rotavirus, plays an important role. Community awareness and hygiene practices are key to reducing diarrheal diseases.